Hi, this is Dr. Amruth from Cessna Lifeline Veterinary Hospital, Domlo. Here I am with a patient with pneumothorax. So bilaterally chest tubes have been placed. So many patients won't respond only with thoracosynthesis. So for those patients, a novel technique of blood patch pleurodesis has been practiced in Cessna here. So I'll let you know about the procedure in the next bit. So ideally 5 to 10 ml per kg of blood has to be applied to each side of the chest tube. The patient's own blood will be preferred for this procedure. If in case patient is quite anemic, so ideally a blood transfusion for the patient has to be done, and the patient's own blood has to be collected from the jugular vein and then infused into the chest tube. So ideally the blood that we are taking, no anticoagulant is required. As soon as we collect the blood from the jugular, has to be infused back into the chest tube before the blood clots. So here the blood acts as a puncture material. Here the blood creates the irritation between the parietal and the visceral pleura and make the adhesions. So these adhesions forms further air leaking from the ruptured bullae. So after the blood product pleurodesis procedure has been done, for at least 4 hours the chest tube should not be drained, it should not be disturbed. Once after the blood has been infused, actually patient's chest has to be gently massaged. After filtering the blood into the chest tube, patient has to be rolled over nicely to ensure uniform distribution of the blood throughout the pleural space.